he didn't stop barking.
He did. I think he saw something.
He started again.
Yeah.
When the cat came out.
Down a little bit.
Girl, he been barking at me.
Yeah, when the cat came out, he went crazy.
Yeah, he can bark at me. I mean, he ain't gonna do nothing to the cat. They don't like him. They'll slap him. Or they'll just move away.
You said, babe, you got more than one cat?
I have to.
Okay, we're gonna go louder.
Let's go.
All right.
All right, so we are back again. I don't know if you caught the other live, but we had a little visitor that got a little rowdy. He became a ragamuffin, and so we had to escort him out the building. It was a dog.
And he said he's been kicked out of better places by taller people than us.
That's probably true. But welcome back to Let's Talk About It with Xavier Fox. So we were about to get into the meat of it. And so Gina Lamar, Gina Lamar is here for Monday Night Mingle. She is part of my crew. I love having her because she talks about the stuff that we all like to do the most. And that is having sex raw.
And not just having sex, but having it raw. Right. That's why it's Gina Lamar Raw, right?
That's better than
real
raw.
ass words about this, right? Because everybody likes to go raw. It's what keeps me in business.
Okay, you do, because that's, I was just saying, you get nice and sweaty, your body start gliding together, get that little rhythm going, and then the next thing you know, I'm sitting in front of you.
Yeah. For many reasons, right? And again, being in front of me is not the worst thing. I'm kind of cute. Mm-hmm. That's just my line. I'm going to say it again and again. No, what does happen, though, and I tell people all the time, if you all just keep doing it raw, you keep me in business, right? I'm an MPH. I can work on flu shots in Florida, the Bolivia virus in Bolivia, and the coronavirus in Corona, California. Oh, but y'all keep me with a job right here in Chicago or right here in the Illinois area because you like to have unprotected sex.
Yeah. Well, I don't. Of course.
Yeah.
I don't.
I say you all as in you the people, not you Xavier Fox, not me Gina Lamar. Mm-hmm. Although I do like to have unprotected sex when
you get to that
when I'm ready. Right,
yeah.
when I'm ready.
But so we're talking about when we go to the club
and I pick up a one-night stand.
Dude.
So let me just say this. Our studies show, and one of the things that we know the most is that when you have random partners, you're more likely to use protection. So commercial sex workers, all the things we try to make derogatory. I think a woman who owns her body and has as much sex with whomever she wants to is her thing. But
absolutely.
Women, we try to make it negative for us, but those women and people, men and women, tend to use protection more because they know it's a random partner. What keeps us at risk is people in these wonderful relationships, right?
Who've made us out there cheating.
Or they came into the relationship with the STD, including HIV, right? So they came into the relationship with us. They may not have been cheating. Then they found the one, and they're not cheating with the one. But they still have the STD. I'm sorry, I'm choking. Can I get a napkin?
You can take a swig of this mimosa. The mimosa will take care of everything.
Thank you so much. My apologies. This is what happens when we go live, right? Please keep talking.
Okay. So I don't remember what I was talking about before she started. She got all choked up about whatever I was talking about. It might have been that sweaty, rhythmic.
You can leave it open.
Sex.
Yes.
Just talking about getting our groove on. But I can understand why people who have random sex partners would use condoms.
Yeah, they protect themselves.
That would be the smartest thing to do. And if you're not in a relationship, then you would. But you said that most often it's people in
relationships, right? Mm-hmm. Like we've been together, and unfortunately, people have been so transient in relationships for so long, really and truly, that when you have somebody who stays with you 30 straight days, you feel like you all are together. Right? Like it does. It happens regularly.
I've been in a long-term relationship, so
we've been rocking well together, right? We're together
for 5
doing
weeks.
This. You got it. And I know he's not cheating. He hasn't been out of my sight. I know she's not cheating. She hasn't been out of my sight, right? Well, first of all, shouldn't be that close that quickly.
Right.
Not saying there's anything wrong with it. I've done it. I've done it as an adult, right? But you have something new and exciting and you're getting to learn somebody, so it's always fun to do. But at the end of the day, you're like, oh, I know she didn't cheat. No, but she came to the relationship with something. So I do have to say to people, if you meet someone, you all start rocking and you start having unprotected sex and gonorrhea, chlamydia, or syphilis or HIV shows up, I don't know. You can't blame them.
I think we got so caught up on the HIV once that hit, we forgot that gonorrhea and syphilis and all that other stuff
I
even
still
exist.
very much.
It's kind of like
active.
when COVID came along, the flu and the cold
Oh yeah.
disappeared
Oh, yeah.
somehow. I don't know how that worked. But.
This is what you're really gonna love. We can treat HIV, but we don't have a cure for gonorrhea. I mean, we don't have anything. We can prevent HIV. We have a pill that you can now take to prevent you from contracting HIV.
Really?
We do not have that for gonorrhea, chlamydia, and syphilis.
And syphilis is the one that makes you go blind?
Syphilis is the one untreated that gives you brain disease, that makes you go blind. You can have mental disorder with it. Yes, so it does affect the brain. It's a blood disease.
Wow.
And if you've ever had syphilis, you will always test positive for it, but we're looking for titers. And so if they're really low, 1 to 1, 1 to 4, 1 to 16, really low, we know that's usually just the fact that you've been exposed to syphilis versus
Really?
like a 1 to 64, that could be a new strain or something. At least that's it. But that's why I always tell doctors, I want my MDs always doing those conversations with us because they know the labs. But I do know for sure that once you've ever tested positive for syphilis, you will always, oh, that's so much better.
Oh my God. Y'all excuse Gina. She
You know, when you
this
see
is why
yourself on
she's
camera.
this is why she's talking about sex raw.
Absolutely. So yeah, but you're absolutely right. Lots of people, when HIV came along, just forgot. I mean, we have people who come in, we call them frequent flyers. They come in and say, yeah, I need a shot. For what, sir? Yeah, I think I got, I mean, I'm sure I know what it is. It's the exact same symptoms. I got chlamydia again. No, sir. We have to always test you. We have to know what that is. We have to document it so that we can keep our numbers and say we had
So
30,000 cases of chlamydia.
we've been doing shows for a while now, and I guess I never.
You didn't pay attention.
I thought chlamydia was women only got chlamydia.
Oh, we have gonorrhea, chlamydia, syphilis that can go with both partners. No, not at all. And trichomoniasis.
Trichomoniasis.
Yes, trichomoniasis.
Trichomonas.
Trichomoniasis.
So is that
Gardnerella. Those are all things that really lie dormant in men, and they can definitely they can be they go so low, right, that you don't detect it right away. That doggone gonorrhea, chlamydia, and syphilis, they come in with the penis out almost like, I'm on fire, right? So they're like, hey, I want to get rid of this right now. Right, they're like, hey, fix this, right? And then it's always, I'm never going to do it again. Boy, bye, please stop. You will again, right? As soon as you let your guard down. But yes, no, sexually transmitted infections can go both ways to both people, and they do affect us differently. For women, unfortunately, we're forever self-diagnosing. Oh, it's just some BV. It's yeast. I'm gonna drink some cranberry juice, right? I'm gonna eat some yogurt. Unfortunately, we've had some women who tried to. I think we're going to sleep over here, Trendy. I think we've had some people who have actually tried to take yogurt and dish with it, right? What? Just poor information, though, right? If you get your information from the streets, then you're gonna do it. And let me say this. Brace yourselves. I'm going to talk about all of our grandmamas. If you get your information from your grandmother, why wouldn't I trust my grandmother? She raised my mother. My mother raised me, and my grandmother, my great grandmother, doesn't know any wrong, right? So we put a little lard on a burn. She may not know better because we didn't have access to medicine then, right? And so if you put lard on a burn, that's not good.
Right. No, it's
But you'll put your little butter on there, right? No, now you're sizzling. Now you're frying. Right. You might as well hop on the skillet. So really and truly, I just finished, well, not just, it's been May now, but I finished it in January, a 5-city speaking tour across the country for the Academy of HIV Medicine. Okay. And it was interesting because I was like, I'm doing the national data, and then we had providers from other cities doing the local data. Shout out to Cassandra in Florida, Miami-Dade County, or actually AHF in Fort Lauderdale, as we talk about the different things. One of the pharmacists was on the panel. And what I recognize is that it's the same all across the world, right? We know this. That's why we have big numbers of all the different cases, that we all are experiencing the same thing. And some people just have misinformation. And when they have that misinformation, they take it and run with it, right?
Mm-hmm.
And then a lot of people are suffering and they don't have to. They think that they, because I've had kids, I'm going to always have a discharge, right? No, you can have a discharge simply because you have a new infection.
Oh, good Lord.
And no one wants to think about new infections. I know I've told you the story before, but it's one of the best. When I was working in the hospital setting, before I opened up my agency, right? In the hospital setting, in the emergency department, right? Guy comes in, one of those frequent flyers, we call them, right? Like you come in regularly, right? But not this one, says, hey, we treated him, right? So he has to now speak to me because he's had unprotected sex and there's an exposure, and we're doing the HIV testing. And he says, can I shoot the medicine into her?
Huh?
You have to watch it now. You have to watch it. See, he couldn't do it good on the radio. Can I shoot the medicine into her? You all see the shoot the medicine? That means, what do you think that means?
He thinks that if he takes the medicine and ejaculates, it'll go into her too.
You got it. And why would he want to do that? Because he's trying not to tell her that he has gonorrhea.
Oh, wow.
So I thought to myself, okay, first of all, if there's not an exposure already, because sometimes partners don't have sex with their partners for long periods of time for whatever reason, right? Like you're busy working, they're traveling, whatever the case could be, right? But he done got this gonorrhea now, and it was middle of January, which meant his housing was very much so tied to this, right? He going to have to be put out if he come home with some gonorrhea. But when he said that, I promise you,
situations, man.
I promise you, all I could think of is that, yeah, there's another case out there that we're going to need to get to, right? Because we know for sure, first of all, the person he caught it from,
Right.
and then the person he's with.
Right.
Now, they could be that same person. Y'all remember the Tyler Perry movie where he was like, you caught thus and so, and she was like, no, you caught it from Walter. Remember?
Yep.
Tasha, he's like, because I gave it to him and he gave it to me.
Yep.
So people coming in to get tested and treated, rather, is one of those things so that when it does come up in the household, test me, right? So no, we can't do that because of people's private health information, right? We can't tell them that, but I'm always teaching folks, if you know you haven't been with anybody else and you come up with gonorrhea, chlamydia, or syphilis, tell your partner, let me see your medical record. I want to see I want to see if you've ever been treated for it, right? We're going dark over here, but I don't know if we can. I just know you have fixed it before, so it's in my head. But it's one of the things that I always say to them, I wish we could go back and test that you asked for that, right? Because of course they'll test negative if they come home treated and never have sex with you again. Unfortunately, lots of people, and it's the women usually, who do not have those options in relationships. So I train physicians, and 20 years ago I was downstate Illinois training a group of physicians at Scott Air Force Base, and we were talking about, they were like, yeah, whatever, right? Group of young docs who have all the answers, and I said, and I'm standing there training, and I said, hey, if I have a woman who has a high viral load and an AIDS diagnosis, a low CT4 count, and after I've trained you, we've given you all funding, we've given you all help to make sure that we keep downstate Illinois clear, I'm walking from this side of the courtroom to the other side. Of course, what do young white men hear? Wait, what? Wait, what are you saying? You can't sue me if she has chlamydia. I said, I can sue you. She can't sue you if she has presented to your emergency room or to you as her provider 2 or 3 times with gonorrhea, chlamydia, syphilis, and you never ran an HIV test simply because she's a middle-aged married woman, right? But you didn't ask, is she in a domestically violent relationship where she doesn't have an option when her husband comes home? right? When her husband comes home and wants to have sex, does she have the option to say no? Like, you've been gone 3 days, dude. No, we need to go test. She doesn't have the option to ask her husband to test, right? But
That's crazy.
yeah, but it happens, right? And they're like, oh, wait a minute. So I said, everyone should be receiving a test. Since 2006, almost 20 years now, right? The CDC has recommended that we all have one test on file, period. If you never have sex again, at least have one test on file. And then otherwise, we have one annually if you're sexually active with new partners or
You're
changing.
talking about an HIV test.
An HIV test, right. And that's simply because we had people who were living with it who didn't present symptoms.
Whenever you change, if you change your life insurance, you have to take one though.
Yes. Some policies are definitely asking for that, right? Which, let's just get to the state of Illinois right quick.
Uh-oh.
Let's do Illinois. While we're talking about that, HIV is state law. So I always remind people, as I was doing this 5-city tour, I'm in Florida, I'm in Texas, I'm in Tennessee, Ohio, and Michigan, right? And so HIV is state law. In Illinois, I don't have to tell you my status. I can have sex with you unprotected if I want to and have HIV. You have to protect you, lady. I don't have to protect you.
Well, how am I supposed to do
You should
that?
know my status and know your own status. If
I
you know you're having
I know
unprotected,
my status.
and if you know you're going to have unprotected sex from me, you can take PrEP. There's a pill
PrEP.
that you can take, just like you take birth control to stop you from getting pregnant. You can take PrEP. You can take this pre-exposure prophylaxis that will allow you to protect yourself from HIV
And go wrong.
and go raw. Not that gonorrhea, chlamydia, and syphilis though. We ain't got nothing for that yet. But definitely the HIV, right? So people living with HIV in the state of Illinois, like really lobbied. Excuse me. They lobbied their providers. I'm sorry, their legislatures and said, if what you're saying is true, if I take my medicine and I'm virally suppressed and I can't pass the virus, why do I have to tell? I'm never going to meet anybody. Every time I walk into a club, I have to say, hi, my name is Gina, I'm HIV positive, right? So if I can just get to know somebody without being criminalized, right? So that first it used to be as long as you used a condom. And you and I had this conversation, what happens if the condom breaks? If the condom breaks, you have to tell me you're positive. Well, it's too late then, right? So they took it a step further. About 3 years now, I think it's been about 3 years. This is 2024, so maybe 2 years. They now, in the state of Illinois, your HIV status is your responsibility. And you know, this whole thing about, oh, if he give me HIV, I'm gonna kill him. We have very few people in jail for murder. You know, kind of like, if I get pregnant, my mama gonna kill me, right? No, they take them grandbabies, love them, lose their mind over them, right? But I do always caution that. Don't make it too easy for me because I'll make my next one.
Yep.
If you take it all off me, right? Like, oh, I don't know anything about getting up in the middle of the night. My mama got up in the middle of the night.
Yeah, I didn't do that. I didn't make it easy for nobody.
Right.
You got to do that. I did it with y'all.
Right. I had to get
That
up.
was enough.
I had to get up with you all. So, you know, that's the side of HIV. So when we're talking relationships, you talk relationships. You wrote a book about it, right?
I want to ask you a quick question before I forget it while we're on the HIV thing. So since Illinois is a you can keep it to yourself kind of thing, or everybody's responsible for their own.
Correct.
I heard at one point that if you knew you had HIV and you willingly and knowingly had unprotected sex with somebody else, you could be charged with attempted murder. So how does that
per state, right? But not in Illinois. So that's the HIV Criminalization Act. That's the law we're talking about.
Okay.
HIV, Illinois, we took it and said, hey, you have to be responsible for your own status.
So you can't be charged with it here.
Not in Illinois. But what do we do? Where do we go to the casino?
Indiana,
Where else?
Wisconsin.
You got it, right? Those are criminalization states. People go right across the border, go have a wonderful time in another state, and you could easily be charged. Iowa, you could be charged. So I was thinking about the bordering states. Or he took me out. What do we call it? I got flued out.
Oh,
Yeah, you got flued out to Florida, right? He took me to Miami. Florida is a criminalization act. never forget, down there speaking, white doc says to me, or we're talking about, HIV criminalization and how it's state law. And she goes, oh no, if a woman has HIV, she has to tell, or it's a 3rd-degree felony. If our patients have to tell, we get to test them whether they want to or not.
How do you do that?
You got it. You got it. So how do you get to test me if you don't? But come on, we're talking Florida, DeSantis, guys, come on. So I said, she said, it's a 3rd-degree felony. I said, okay, so that's why I remind people HIV is state law. So let me hurry up and get up out of y'all state while I'm speaking, right? And then I made sure I circled back. I might be a little petty Betty, but I made sure that I said, hey, about the labs, do you guys get 1st and 3rd trimester or just 1st trimester or what's this and so? She goes, oh, I can't. I said, what do you guys get? She goes, I can't remember. Oh, you can remember that it's a 3rd-degree felony on a Black woman or a Haitian woman who's come, or a Hispanic woman who's come to Florida, because that's a really high population. You can remember it's a 3rd-degree felony, but you don't remember what quarter to get labs in.
Oh.
See how you have to tell you know,
Okay.
again, I just knew the academy was gonna pull me out and say she can't train for us no more. She gonna get
They
us in
like
so
you.
much
They
trouble.
like you
Right?
more.
Every city I went to again, I was like, oh Lord, this is gonna be the last one, because the racism is so real.
Oh,
The
yeah.
sexism is so real, right?
Yeah.
In one of my other cities, hey, Cleveland, what up? Stand up. We had a provider who, they have to do the panel after me, but he's a Caucasian male who's like holding court by the time I got there and stuff, right? He's telling all the people on the panel what they're going to discuss, and he's got his slides and stuff, and still not recognizing. I don't know how. My picture is the biggest picture on the entire, all the flyers that went out across the country that said register, because you get continuing education credits. This is how doctors and nurses keep their licenses, like going to these events with me, right? And so,
So you're kind of a big deal.
not at all. I promise you I'm not, but a little bit, right? But I love, because he's standing there holding court and didn't recognize that I was the keynote speaker. So he says, well, now, what are you going to do again? And
What are you going to do again?
And one of his pharmacists said, that's Gina Lamar Evans. And he says, I know, she's on the, no, in his head, he just couldn't take it. He couldn't take it that a Black female was the person. And as a matter of fact, one of the other providers tried to pull it. And I said something like, why do you think your patients don't tell you, healthcare, right? Why do you think your patients don't tell you that they could be pregnant again or had sex or missed a dosage? Oh, they don't want to disappoint me. I said, wow, I love how you made it about you.
Right.
They don't trust you.
Right.
How did you just make my health care about you?
Right.
And I had to make sure I checked her. I said, because I know what Black patients are saying. I know what patients are saying, because as the case manager, you and Ned have been in there with the doctor for 2 hours. You come out of here and tell me a whole plethora of stuff that I'm saying, well, did the doctor order this, or what's happening? Well, I didn't even talk to her about it, right? Or him about it, right? I'm like, So that's just kind of that's the business side of what I talk about. But yes, the Criminalization Act, and when people say, oh yeah, this one guy gave it to 146 people.
Jesus.
And I say, well, ma'am, I'm a public health official. I can't confirm or deny what you read on the internet. She goes, no, it wasn't just on the internet. I looked it up. And I said, in the card catalog? Like, where'd you look it up? Because you Googled it. Guess what Google is? The internet.
Yes.
So if you see it on Facebook and then go to Google and confirm it,
It's the same thing. Because it's probably going to pull up the same
it's the
article.
internet. And you and I both know, having businesses and using social media, that just because our name comes to the top doesn't mean it's correct.
Right.
It just means it's the most searched.
Most searched, yeah.
Or that we paid for SEOs. Search engine
I got all happy
optimization.
when you can Google Xavier Fox, and I'm the first one that pops up.
Of
now.
course.
I'm like, hey, because there was some other guy that was Xavier or Fox or something
Yes,
like that.
yes.
And
it
he
kept
used
coming
to
up.
pop up. I'm like, oh, he gonna pop up.
So let me say this, because she will be watching it. She's in Texas. Shout out to Gina L. Evans Hudnall. She's Dr. Evans. She's Dr. Evans Hutton. But my
Oh, she
sister was
must-
looking for me.
Google, okay.
Right. No, my sister was looking for me and said, hey, there's another Gina Evans. So I called her like years ago and said, hey, my name is Gina L. Evans, right? And I said, but every time we Google Gina Evans, because she's a badass doing really great research
Okay.
in Houston at Baylor Medical, right? She's a clinical psychologist, right? And so she's doing really great work with veterans. So now we're really great friends. We just talked recently. So I saw her when I was in Houston speaking, and she'll be coming to Chicago. She's from here, and yes, we connected. But I called her and said, "Hey, I'm Gina Evans. I wanted to meet you." So I get there, her whole family's like, "This is the weirdest stuff. This looks like some Lifetime stuff." This was years ago. Their kids are teenagers now. So her husband, we all had lunch when I was down there, and he's cracking up laughing, telling everybody, I was like, yeah, she called her. And then I don't know which was weirder, her calling or my wife saying, okay, let's meet. Now you can't tell us nothing. Now you can't tell us nothing.
Now, y'all. So there's an Xavier Fox in Indiana, but she get in a lot of trouble. She been in jail. She done did a whole lot of stuff.
Sure it's not you, X.
It's not me. It definitely is not me. She's younger than me too, but she get in a lot of trouble. I'm not gonna call her up.
Really?
No, I ain't gonna call her up.
I love it. Yeah, I was just gonna say, yeah, don't connect with her. But so I would say, as we talk relationships, and we're always talking relationships, I'm always talking about it from the healthcare side. And unfortunately, I've learned and seen some really, really, sad things over these last 30. I've been doing HIV for 30 years.
Good grief.
Yeah.
I remember when it wasn't even a thing.
Yeah, I remember 30 years ago when our patients were dying, right?
I remember
So
that.
I have to triage patients with Nephew's Case Management. That's my agency. And we have to triage people within 72 hours. Because back in the day, if you got referred to us for home services, back in the day, if we waited 2 weeks, you could be dead. Like, people were dying so quickly back then. But now, I tell people all the time, if I test you, because we still do testing, and we will be on Saturday, June 15th for our 4th annual block party, right? Nephew's Block Up Party. If I test you and you're positive, just do what I tell you to do, and you can go ahead and die whatever your grandmama died from. Whatever, if y'all got sugar in your house and
So
family
really,
diabetes,
it's become like that now.
that's why we're losing so much funding. That's why, we used to give you an apartment at the top of Lake Point Tower, and we just rotate the apartment because we knew you were going to be gone, right?
Damn.
But now you can live a long, healthy life with HIV. So
Really?
that's the part.
So whatever was it? Is it Magic? Whatever Magic
absolutely.
is doing now, everybody has.
And Magic had been doing it. Magic did exactly what you also said about those pregnancies, right? Magic didn't have to get up and go to McDonald's and walk 5 miles to get there and flip burgers and open the store and work 12 hours. You know what I mean?
Mm-hmm.
When he wanted to rest, he could rest.
Mm-hmm.
But he definitely had access to medication.
Mm-hmm.
Now you talk about the relationship side with Magic. I just love to always point this out with Cookie and Magic, right?
Mm-hmm.
Everyone talks about that with Cookie and Magic. And if you ever watch the movie The Announcement, when he announced about his HIV status, Cookie said, when they were talking about it, she said, I thought, he's calling me. He's supposed to be on the court right now. Why would he be calling me now? He's supposed to be on the court. And he said, I'm coming home. We have to talk. And she said, I thought, oh my God, does he want a divorce, or is it taking so long for him to marry me? And the bigger message with that, we're going to argue, the biggest message with that is, I don't care what happens as long as he don't leave me.
What?
Think about it. She stayed with him, but she was worried that he was going to be breaking up with her. He was coming home to tell her that he had HIV.
That's wild.
Yeah, so we're totally dark here.
We went to sleep over
We
here.
were totally to sleep over here.
So we just got a question.
Oh,
We are.
good.
Okay.
We go dark, y'all still are.
Okay.
You know what, Trinity? Then why you tell me that? You know we sitting up here worrying. I'm like, hey, wait, you can't see me. She's
Okay,
so
we
smart.
good.
But
But you know what
you
else?
know the old folks, we can't see the light.
Because me and Gina could keep talking past our time. So when you get, give us a 10-minute countdown. I know we still live. I'm just asking our set assistant to give us a 10.
Yes. Wrap it up.
What?
10 minutes till
1:30.
All right.
Yeah, we're here with y'all till 1:30. And if you have any questions for Gina,
Oh,
make
please.
sure that you put them wherever you put them, in the comments section, wherever the comments or whatever go, or the questions. Is that where the questions go, in the comment section? Okay, make sure you put them in there, and Gina will be happy to answer your questions. We had some
Absolutely.
really
Whether
great
it's a,
questions last
whether or not it's like the right answer or not, I'm going to answer.
So the relationship part of Magic and Cookie, and the fact that you just said what you said, to me that's really scary, because it almost sounds as if she was really defining herself by who she was married to, you know.
Well, let me say this, and that, I'm glad you said that, because it does look like it's a negative connotation, right?
Mhm.
It's a negative connotation on her. No, but what I also believe is that she understood the science. She recognized, because this was 30 years ago, right? It was 1994, right? So she also recognized that if I follow the instruction, and now that he's positive and I'm not, we use condoms, you know, there's no reason to mess up my happy home. Like whether or not he cheated, whether or not. So two things with Magic.
They
right?
sign up for that though. That's kind of like a whole given. The basketball wise,
It is not a
the
given.
athletic,
Ask
athletic,
Jackie Christie.
entertainment.
Jackie said she's not gonna, her husband not gonna cheat on her.
I don't care what Jackie Christie said.
You know
Aside
exactly.
from the fact that he's not the most attractive man, but that don't even matter because
He's a professional athlete.
exactly.
Patrick Ewing.
He done had his.
Scottie
He done probably.
Pippen.
You
No,
know,
I'm kidding, I'm
you
kidding.
know how many people he done probably paid off so that they don't say nothing, because he knows she will go straight crazy because she's a little touched.
Yeah,
She
so
knows she's a little touched
there are a
too.
couple of things that, like I say, when we talk about relationships, like once you understand the science of it, it's really different. So I tell people all the time, if I test you for whatever your grandmother died, you know, if I test you, you're positive, you know, you can do that. But bigger than that, do you really want to be in a relationship, right, where you have to always question when your partner comes home, did they bring something home, right?
Yeah, I wouldn't want to.
And so the joke about Vegas, what happens in Vegas, what?
Stays in Vegas.
Except for gonorrhea, chlamydia, syphilis.
They come with you.
They come with
They don't stay.
That comes home. Yes.
You all didn't mention HSV or herpes. That's a
Oh,
big one.
absolutely. So thank you very much for that. Herpes is one of those, and people hate to have to hear it. It still didn't come back up, but you hate to have to hear it. But herpes is one of those that you can contract from your grandmother. No, we don't have a cure for herpes.
You can contract from your grandmother.
Absolutely. If your grandmother has a cold sore and kisses you, she can spread herpes. Cold sores are herpes. Gotta tell this funny story. I'm talking to a group of teens, and unfortunately, they had a school teacher. They had a teacher who had a cold sore like big as this right here on her
damn.
lip, like
Not
that. And
like
you know,
that.
and you know she's white, so it's like it was big and red.
Mm-mm.
And I was speaking, and the kid said asked about herpes, and I said cold sores are herpes, and they said no, but it's a different kind. I said it is not a different kind if you have oral sex and you have an open sore here and touch the genitalia. Now you have herpes on your genitalia. Or if you wipe your mouth and then wipe yourself or hold your penis, you can spread herpes to other parts of your body. So you're right, HSV, we do not have a cure for. HPV, we do have a vaccine for, right? So when you have youth that are eligible for vaccination, HPV usually clears itself on its own, but for some people it can.
So now,
It
cold
creates
sore, we're
cancer.
not talking about you get dry lips in the wintertime, you get that little crack in the corner of your mouth sometimes when your lips is dry.
Ma'am,
That
once
used to happen
again,
when I was-
you like a guy, the guy who walked in. I have to test that. It has to be an open leash, because you can't do it. You can't come afterwards and say, hey, what's this scar? Was that herpes, right? We need an active lesion that we can test.
Because
right?
when I was a kid, I don't know what my
Yeah.
mom was doing. She didn't know what she was doing either. But so my lips would be dry. Now she put that Vaseline on there, but I don't know if
Hey,
it
ain't
didn't
nothing like
really
good
work.
old Vaseline.
That didn't really actually work for me that well. So sometimes my lips would get really dry and it would
And you
like
can get a
crack.
crack or something, right? So herpes is a cluster of bumps. That's a different
Oh
thing.
yeah, no, I had
So that's
that.
a cluster
Okay.
of bumps that usually
All right.
comes with a little
You
fever.
had me scared.
That comes with a little fever, a little lethargy. You're tired with herpes,
Oh yeah,
right?
no, I had all that.
You have all of that,
No.
and you're feeling it. You're kind of down and dry, and then all of a sudden you get the thing. Because herpes is one of those, HSV, which is herpes simplex virus. Herpes is one of those that you don't even know you have it till you spread it. You're contagious most before the bump comes up. before the bump comes there, right? That's when you're most contagious. So unfortunately, herpes is one of those that's highly contagious. You can get it from your grandmother if she has a cold sore and kisses you.
Wow.
So I was want to remind people of that because it is what it is. But again, you can live with it. Now, herpes is like shingles. It can come back out and really be bad. So get your shingles vaccines. Make sure you get, there's a vaccine that you can get to prevent you from contracting shingles, which is very painful, just like chicken pox, and or herpes, big clusters of pain and stuff. So yeah, we have a lot of things out here now with modern technology. We also have the good old relationship thing. Take 5 minutes to get to know your partner.
5 minutes. Let's
Just
take a
5
little
good
bit more
minutes.
than that.
That's just, but I'm saying, if you really took 5 good minutes to ask the question. I was at a speed dating event years ago. I'm sure 22 years ago, because the guy I met, it was my 35th birthday and his 50th birthday.
Oh, he
But-
was trying to get a little young hot thing.
Right. Trying. He won, succeeded.
Oh,
But no,
yeah.
but no, we were doing the speed dating thing. And so, they're asking questions and people, so I'm asking different questions. And the girl next to me says, what questions do you have? I have different questions. I said, girl, I'm not asking these questions. I don't care if he likes the lake or the ocean. I don't care if he likes a sunrise or a sunset. How many kids do you have? Have you ever had an STD? Have you ever been in prison? I need to know these things, right? Do you have child support? That's what I want to know
That's a
in
big
these
one now.
60 seconds.
Yeah.
In these 60 seconds,
Yeah.
right? That's what I knew.
Yeah.
And we laughed so hard. She was like, I'm sitting up here asking, what do you like? Do you like dogs? Do you like cats?
Right.
Do you like the ocean?
You need information to make a real decision.
I need to make.
Like, am I going
I got 3 minutes.
in
Right,
my
I got
life
5
for
minutes.
real?
I
Yeah.
got it. I have 5 minutes
Because
to
if
get
you
to
got
know
12 kids and child support, we can stop right here.
And
after
that's
this
what I
question
mean when I
and move
say
on.
you can. And that's exactly what I mean when I say, if you take 5 good minutes to really ask the questions, right?
Mhm.
And make them make sense. You're widowed. Actually, I'm going to a widow's event after this. She did a very nice collage. I had her on the show once.
Oh, the lady,
Yes,
okay.
yeah, Elle Davis. She's done a 5-week oh my goodness, at a museum, at an art gallery, I'm sorry, on widows and stuff, and Black widows.
Oh.
Very, very deep. Because one of the women said, I did opening night with her, and she said, hey, when white women lose their husband, the whole society's like, oh, she lost her husband. Black women is like, oh, yeah, she lost her husband. Keep on going, sister. We just have to persevere.
That my mother-in-law actually told me that
Yeah.
when I was grieving. She said, you got to pull yourself together. I mean, it had only been maybe 3 weeks.
Yeah,
She's like, you got to pull yourself together. She said, you got those kids.
yes.
And if you don't do it, then who going to do
And
it?
who's going to do it?
And, with that kind of question, the answer is nobody else is going to do it.
Nobody.
So
There
you
is
do
nobody.
have to almost tuck
Yeah.
it away.
Yeah. I've often thought my friends, when we go through breakups, because I am absolutely dramatic. I know you don't see that at all. But like, I lay all the way out. We like 5th grade. If I break with you, we all break up. Karen, you cannot talk to him again. Gina, it's my brother. I don't care. If you really my friend, you don't mess with him no more. Everybody delete him. You mad at him, right?
Oh, that just sounds like
And-
Chicago. That's
Right,
like
right.
Chicago.
That's so true, right? We all mad at you, right? And so no, really, we do when we're talking about relationships and stuff, but I often say, because this just came up again, not to get too personal, because people know on social media, a couple in Chicago, but like, if your husband dies, if you and your husband divorce, people say, forget him, get out there, get you somebody else, go date. But if he dies, you dating again? He's only been dead 10 years. You're right. Like, but that's our psyche. Like,
He's
how
been
can-
dead.
He's been
I'm
dead.
still here.
If you get divorced, you have a chance of getting back together. But they really trying to get you to date again, right? So I always say, well, I'm always talking about the medical side, the health care side of relationships. And that's why I say my tagline is I get to talk about sex for a living, right?
Mhm.
Because it still remains the #1 mode of transmission for HIV, for gonorrhea, chlamydia, and syphilis, and for that good old herpes.
It's funny
It's
because
not
I
supposed to.
never knew that we could get herpes just kind of almost from anybody.
Yes,
I never
herpes
knew
is
that.
It's viral.
I
It's
thought
very-
it was a
it's
sexually
highly
transmitted
contagious.
disease.
Not at all. And on the genitalia, but that's people just have.
But
to
you
cook
said
for it.
if you got a cold sore and you
wipe
touch it
this,
yourself.
yes,
So now you done put it down there.
you can possibly spread it to yourself. Yes, that's what some studies have shown. Because it's if you have the mucus from the bump, you can. But again, you can live a long, healthy life with herpes. You really can. You
So-
can even with HIV and with PrEP. Let me just talk PrEP again very
Okay.
quickly. It's the pill and now injectable that you can take. It's the pill and now injectable that you can take to prevent you from contracting HIV.
Okay. I just wanted to say I became a widow so long ago and I was so young. So whereas we have people that do, try and push whatever their thought or belief is onto, people who have a spouse that has passed, I was only 31. Nobody even really acknowledged it at all.
Yeah.
I just kind of went
That's
through
what
it.
Ella's saying. That's exactly what's happening.
You just kind of muddle through it,
Yeah.
and then when you
Yeah.
tell people, the people you're talking to are in your age group, so you tell another 30-year-old,
Yeah.
my husband died, they don't know what
Yeah.
to say to you
Yeah.
either. Everybody's like, oh man.
I hate to one up you, but Aixa, shout out to Aixa. She's in Ohio now. We went to high school together. We've just been talking recently because it's our 40th anniversary of Josephine. Still producing fabulous women 134 years later. But young Hispanic woman, got pregnant at 16, got married at 17. She and her husband and the kids, Puerto Rican family, out at the beach. Her husband drowned, got caught in one of them riptides in Chicago. So when we graduated, she was a mother and a widow.
Oh my
When we
God.
graduated from Josephine High School in 1984.
That was traumatic.
Absolutely, absolutely. It also gave her some life lessons and also gave her time. You know what I mean? She had to heal from that, but
Yes,
still
yes.
had a chance to have a different kind of life. Yeah.
Man.
Yeah. So like I said, we know that with death, we're always like, hey, you can't date again or something. But with breakups, we say you can do it again. So that's why I'm always talking relationships. I hear it from a different side, and I do say lots of my patients have said to me and clients over the years have said, if I knew what you're telling me now, I probably wouldn't even be positive because I just didn't recognize I had access to my body. That's why I fight so hard with women's rights.
What's funny is I was about to
I
say,
run this.
I was about to say I've been in relationships so much, but that really doesn't actually matter. I figured that I wasn't active like with a bunch of folks because I was always in these long-term relationships.
Yeah.
But if they were cheating, then that wouldn't have
I was
protected
just
me
going to
either.
say, because
Yeah,
a bunch of
I know
people
that
think
much.
a bunch of relationships, people in a bunch of relationships protect themselves. It's when we fall in love and he's my husband and
Well,
we
I was
together.
in love and they.
Well, I mean, and we're in love and we're together. That's when
I'm
people
talking
let
about
their
the
guard down.
1+ years past the 1 year thing.
But yes,
Yeah.
I'm saying, but
Yeah.
that's when women let their guard down.
It is.
That's when we let their
Because
guard
you
down.
feel like they really into you.
Yes.
I still feel like most of them really were.
They might be, guys,
Yeah.
but I'm gonna ask this question as we wrap it up. Get it? But I'm gonna wrap it up. I'm gonna ask this question, really. How many times when
How's she
you
gonna wrap
started?
up my show?
I know, I mean, you got it. You know what I mean. I meant my to wrap it up. I knew you were telling me we gotta go, and your assistant's giving us things, but no, you're absolutely right. I'm not wrapping your show, but I will say this, as we're talking about it. How many times have you met a partner and said we both need to go and get tested, not just for HIV, but for STIs and everything before we have sex, not just unprotected sex, but sex. I know it doesn't happen. I know it doesn't happen. If it did, I wouldn't be in business.
Right.
And so I know it doesn't necessarily have to see.
Actually, I think that is the 1:30 bell for me. Now I'm gonna wrap her up.
I'll take it.
All right, well, Gina, so tell us about a little Monday Night Mingle. Everybody in Chicago that's watching, I know you've heard
Of Monday Night Mingle. So no, you have to watch the page because we have a couple more things that we need to confirm. My
Okay.
minglers have been asking over and over again after COVID, are we doing it? We do have candid community conversations every first Tuesday on the internet. We're still live. I did PrEP for Black women, the drug that you can take. I did a live event in March for Women's History Month, but for the most part, just go to ginalamar.com and I will keep you posted. I will get some stuff updated. And then I promise you'll keep seeing me on the Xavier Fox show.
And if you come to the Monday Night Mingle, it might happen because she's done it before. Xavier, come on up here and get on the mic and let's have a conversation.
I will still say her our daughter got the most views when we were on the Pier 31,
Oh, yeah, she did
and
that.
we were playing limbo, and she went all the way down.
Yeah.
And everybody was like, yeah. So yeah,
Yeah,
that really does.
That was before
one of
Shay was pregnant, though.
my- Yeah, of course.
She was
of
like
course.
27 then.
Yes,
She went all the way. I was like, yeah.
She did.
Now she
But it was
got
a great
3 of 'em.
time. Yeah.
She got 3 kids.
I know. I
Yeah.
know.
They
Look
so
at that
cute.
time.
Well, thank you everybody for watching, and we will be back again. So we will be back on Friday. This coming up Friday, we will be live in Milwaukee with Girl Talk. We got Girl Talk +1. So we have 4 ladies on the panel, and we have 1 guy who's gonna ask us 4 questions.
Ooh.
And we're gonna get some real interesting responses. I'm sure about that. So make sure that you tune in. Make sure that you subscribe to X Fox Entertainment, X Fox ENT on Instagram, Xavier Fox Media and Events on Facebook, and X Fox on the Box on YouTube. I really want all them things to be the same thing, so I don't have to remember that. But you know what's easiest? Just go to Google and type in Xavier Fox, X-A-V as in Victor, I-A-F-O-X, and that'll pull up all the stuff that I've done. You'll get my new website and all that kind of stuff. I think the new one is live. I'm not sure. I won't tell it until I know the new one is live, but it's going to be really good. So make sure that you tune in and check us out Friday at 6 p.m. See you later.